So in this video, what we're going to talk about are antibiotics and other drugs that are used to treat dental disease. And I think there's a lot of confusion on that. The most important thing to remember, and this is kind of common sense, but the simple things are always sometimes easy to forget, is number one, you have to have an accurate diagnosis when it comes to treating dental disease, sinus disease, nasal disease. It's not always as straightforward as it seems. So the diagnosis is first and foremost the main thing that we should focus on. Once we have a definite diagnosis of dental disease or sinus disease, a lot of times what we're taught in veterinary school is to resort to antibiotics. And when we're using antibiotics, because there's concerns of antibiotic resistance, we want to typically select for the type of bacteria that we're encountering, and that's good medicine. So typically we use cultures and sensitivity. That's what we're taught, and that's good medicine. But with dentistry and dental disease, it's a little bit different because mostly antibiotics are adjunct to what we're doing. They will not really ever fix the primary problem. It's very, very rare to have true dental disease, a true dental infection that will resolve with antibiotics. Because what happens, a lot of people don't forget or don't remember, is that a tooth is essentially like an implant. So like, let's say that you have an orthopedic patient that you put an implant in a plate and screws, and the plate and screws become infected. You end up, no matter what antibiotics you use, that implant will have to be removed because there's so much bacteria that colonize that implant, and the blood flow often to the implant, it doesn't really exist because it's a man-made material. And so, and antibiotics need blood flow to be delivered, that you can kind of delay things, but eventually that implant will have to be removed. It's exactly the same thing with infected teeth. Infected teeth are this kind of inert body that's a foreign body, and once it gets colonized with bacteria, there's really no amount of antibiotics that are going to fix it. On young horses, what happens too is that you have a big apical foramen where the pulp goes into the tooth. The younger the horse, the bigger the pulp is. If you have a pulpitis and that tooth is dead from anachoresis, you have a giant foreign body that's soft tissue within the tooth that has no vital blood supply. No blood supply means no delivery of antibiotics. That means that there's nothing that antibiotics are going to do. It doesn't matter what caliber of antibiotic you're using, it's not going to do anything. Where antibiotics play a role is if we have a tooth infection and that's expanding and causing a lot of pus and abscessation and infection, the antibiotics can keep that at bay a little bit, so they can buy you time before surgery, they can reduce the degree of pain and infection before the surgical procedure to remove the tooth. But that's all they're doing. They're not fixing the problem. I see so many horses where they go on and off antibiotics and they give this false sense of illusion because that will shrink the infection for a little bit. But then either one of two things happens. Either the infection will break and drain somewhere. It could be under the jaw, it could be into the sinus, it could be into the mouth. But pus is being discharged somewhere. That can give the illusion that the antibiotics actually help, but they didn't. So I understand why a lot of people use antibiotics, but it should be just a band-aid to buy you time. Okay, so now the next topic is, once a procedure is done, we have a diagnosis, we remove the tooth, what antibiotics are best for dentistry? Anything. Because once you remove that infected implant, the best antibiotic in the body that people forget is the immune system. The antibacterials that we use that are commercially made are an adjunct to basically let the immune system get ahead enough to where it can wipe out the bacterial infection. If the immune system is not robust enough, or if something is totally immunosuppressed, it doesn't again matter what antibiotics are used, because the immune response is a key factor. Okay, so once we've removed the primary problem, virtually any antibiotics in most cases, just something broad spectrum, reasonably priced and safe is going to be the best antibiotics and antibacterial therapy. We do in our practice at least 250, maybe 300 fairly advanced difficult extractions every year. We see a lot of sinus cases, a lot of infected teeth, and 99% of the time we just use broad spectrum antibiotics such as sulfas. That will literally get you excellent results. If you don't remove the problem, then it doesn't matter what antibiotic you use, it will not resolve it. Occasionally you do have to adapt the antibiotic that you use based on resistance or susceptibility. So I'm not saying that's never the case, but generally speaking, removing the primary disease process allows you a wide range of antibiotics. In fact, in many cases, I would say, we actually don't use antibiotics once we've removed the tooth. If the surgery goes very well, then in many cases, just simply removing that nidus of infection, the immune system will take over. And it's the same with sinus infections. With sinus infections, the worst thing you can do is put them on antibiotics, take them off, put them on, take them off, put them on, take them off. That's obviously can create resistance, but it's not treating the primary problem. What we found is that if we go in and remove the primary cause of the sinusitis, whether it's dental disease or something else, and then remove as much of the pus and infection within the sinus as we can, that may be mechanically through a surgery, or it could be through transnasal sinoscopy, it could be through minimally invasive flushes. But removing again that nidus allows the body to basically take over and clear that sinusitis. Typically when the case is not healing, it's rare with dental disease. With other parts of veterinary medicine, it's different, very different. But with dental disease and sinusitis, when they're not responding, it's not often that it's due to bacterial resistance. It's more often that there's a nidus that is not being discovered. And those can be very challenging to find. Fortunately, with CT and then advanced endoscopy or oral endoscopy, we're getting better and better at tracking those down. But the cases I found where I'm not getting the desired response, most times it's that there's another nidus somewhere. It could be a little dead piece of concha, a dead piece of bone, a little sequestrum. There's again a nidus, a little piece of tooth, something that's holding that infection. So I think hopefully that helps you guys to not get so caught up on spending a lot of money on susceptibility and culturing. I'm not saying don't do that, because that is good medicine, but first and foremost, make sure you're removing that primary cause, and keep in mind that once teeth are infected, they don't get better. All we're doing is masking the signs, so get rid of that and horses will do great.